Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes. Bipolar disorder is a complex mental health condition. It affects millions of individuals, affecting their daily lives, their relationships, their overall well-being. Today, we're talking with psychiatrist Dr. Scott Murphy about this, and thank you so much for being here today.
Of course.
Tell me what bipolar disorder is. What characterizes it?
So this is one of the mood disorders. And so more commonly we think of major depressive disorder as the depressive episode. Bipolar disorder has those as well most of the time. But it's mostly characterized by a different type of episode called a manic episode. And those can be very disruptive to a person's overall life. They can lead to hospitalization. They can have symptoms that are quite severe.
So you mentioned there's the depressive and the manic phase. What kind of things happen during? I think people can imagine depression, but describe to me what that manic phase can be like.
Sure thing. And this is the key diagnostic symptom for bipolar disorder. So in a manic episode, the brain, instead of slowing down, gets revved up. And so people's thoughts start to move very fast. They can speak very quickly. Their actions can become very impulsive, and they can do things that are out of character for them. Often people stop sleeping entirely or sleep very little, but yet feel like their energy is very high, and this goes on for many, many days in a row. With a full manic episode, a person might sleep 0 in 7 days and still feel like they have all the energy in the world.
And you mentioned impulsive decisions, so maybe making purchases that they can't actually afford, or breakups, or things like that. So all things to watch for.
Yeah, and at the more severe end of an episode, people can have psychotic symptoms, which are similar to what we would see in schizophrenia. So seeing and hearing things that aren't there, developing delusional ideas. And sometimes the thoughts are moving so fast that it's difficult for the person to speak fast enough to keep up with them, and that can lead to a disorganized speech pattern in which it's very difficult for others to follow what they're saying.
How do you diagnose bipolar disorder?
So it can be easy to miss, and honestly, most people who have bipolar disorder, for around the first 10 years or so of the illness, they are misdiagnosed as having major depressive disorder. Earlier in the lifespan, the more common episode is the depressive episode. Subsequently, if a person develops a manic episode, then the diagnosis gets revised to bipolar disorder.
Are there triggers for this?
They can be triggered by life circumstances, but there's a strong genetic component as well. It most often runs in families, and so if someone is being treated for depression and they have a strong family history of bipolar disorder, they may also have it as just a part of their genetic background.
Okay, so you discovered that you have bipolar disorder. Describe to me what the treatment is like.
It's important to get the treatment right, because some of the treatments that can help with a depression episode can actually worsen bipolar disorder. Medicines like traditional antidepressants, things like SSRIs and SNRIs, can sometimes make mood symptoms worse or even trigger another manic episode. And so we have to use a different class of medications called mood stabilizers. And those tend to come with somewhat more side effects, but they're the kind of medicines that can help someone stay out of the hospital if they're needed.
Yeah, that's important. Now, while you talked medication, what role does therapy play in treatment?
Therapy is a big part of treating both depression and bipolar disorder. In the case of this illness, mania or manic symptoms won't respond directly to therapy typically, but coming to terms with the diagnosis and coming to understand the role that medicines can play in helping to keep someone stable and keep them out in the community and not being in the hospital, building bridges among family members, helping with education about the diagnosis, all of those can play a big role. And therapy really helps with all of those things.
You mentioned family and friends. How can they support someone who's dealing with this condition?
A good checkpoint is to, first of all, and in psychiatry we try to do this, is to not have judgment, to understand that an illness is an illness. And that if someone is undergoing a difficult episode, having a manic episode, that a lot of their actions they may not recall after this is resolved, and they may not be entirely aware of what they're doing. And helping with sort of the daily infrastructure of trying to remember to take medicines and things like that can help too.
There's a lot of support needed for sure. Dr. Murphy, thank you so much for being here. We appreciate your time.
You're welcome.
Thanks for checking in for Monday Health Minutes.